Congrats on bringing a new life into the world. Whether you're a new or experienced parent, we welcome you to learn about breastfeeding, which is also known as chest feeding or body feeding. Breast milk provides ideal nutrition for babies, and breastfeeding has multiple benefits for both the breastfeeding parent and baby.
I would really like to breastfeed, but I'm not sure if I can. I'm taking a couple of medications for a medical condition.
It is recommended to continue breastfeeding while taking most medications and with medical conditions. I am glad to check whether or not your medications or medical conditions are compatible with breastfeeding.
How do we get started with breastfeeding after birth?
During the golden hour immediately after birth, your baby will be placed skin to skin with you on your chest. Skin to skin helps to regulate temperature and blood sugar and helps babies breastfeed for the first time. It is important to breastfeed frequently when your baby shows hunger cues to produce a strong milk supply. Each drop of the initial yellow colostrum is liquid gold and should be fed to your baby. Colostrum is extremely nutrient-rich and supports your baby's immune system.
Breastfeeding is so natural. It must be easy, right?
Learning to breastfeed requires patience, practice, and support. If challenges arise, your medical team can create a plan with you to ensure a successful breastfeeding journey.
The two main things to focus on when you start breastfeeding are positioning and your baby's latch. There are many different breastfeeding positions, including cradle, cross cradle, football, laid back, upright, and side lying. It's important to make sure that both you and your baby are in a comfortable position where you can reposition and adjust the baby to your breast easily. You may need to use pillows or other supports to get into a comfortable position. Your medical team can help you figure out the best breastfeeding position for you and your baby. Next, baby's latch. The basic steps for latching are: 1. Tickle your baby's lips with your nipple to encourage them to open their mouth wide like a yawn. 2. Pull your baby close so that their chin and lower jaw move into your breast. 3. Aim your baby's lower lip away from the base of the nipple so that they can take a large mouthful of the breast. If your baby does not latch properly, gently insert a clean finger into the side of your baby's mouth until you hear a sound that shows the latch is broken, and then try again. It may take a few tries to get a good latch at first.
How do I know that my baby is latching correctly?
With a good latch, you may feel a strong tug. If you feel pain, it is likely that the latch is not good. Your baby's mouth should be open wide with their lips turned out like a fish. You may be able to hear or see swallowing, which indicates that your baby is feeding well. Your baby's back should be straight with their ears, shoulders, and hips in a straight line.
How often should I breastfeed?
You should breastfeed whenever your baby is showing hunger cues. Generally, you should feed your baby at least 8 times in a 24-hour period. However, some babies may want to eat more frequently during periods of rapid growth. If it has been 3 to 4 hours since the last breastfeed and your baby is not showing hunger cues, wake them up and try latching them on.
What are the feeding cues we should look for?
Early feeding cues include rooting and moving with their eyes closed. Later cues include eyes opening and sucking on their fingers and hands. Late cues include fussiness and crying. You should feed your baby when they show earlier feeding cues. Once they are fussy and crying, it may be challenging for them to latch properly.
No matter how hard I tried, I had low milk supply with my first baby and had to supplement with formula. What if I can't breastfeed my new baby? Will my baby be okay?
It sounds like you are nervous about breastfeeding and making enough milk for your baby. Every breastfeeding journey is a new experience, and we are here to help you. There are many ways to give your milk to your baby, including finger feeding, spoon, cup, oral syringe, supplemental nursing system, or bottle. Hand expression and/or pumping while you are apart from your baby will also help you maintain your milk supply. Talking with your lactation consultants or breastfeeding coaches can help you optimize your milk supply and make a plan which will work for you and your baby.
Breast pumps and formula can be expensive. Are there resources available to help support parents?
Absolutely. Your medical team can help connect you to resources such as the Women, Infants, and Children or WIC program and your local lactation support. You can also talk to your medical team for more information about ordering a breast pump through your insurance. In summary, breastfeeding has many benefits for both baby and parent. Work with your medical team to establish good breastfeeding techniques early to ensure a great milk supply and optimal growth for your baby. You are amazing parents and will feed your baby with success.